Now, as far as the visitor policy in our outpatient clinic goes, we are currently not allowing any visitors to accompany our patients for their in-person clinic appointments. How might coronavirus affect your pregnancy? Well, the data is limited for COVID-19, but we are learning more and more every day from our Chinese and our European colleagues, as well as our colleagues on the East and West Coast. We also can turn to previous epidemics such as SARS and MERS to see how pregnant women were affected during those outbreaks as well. Looking at the older data, it does not look like women who are infected with coronavirus have a higher rate of miscarriage or stillbirth than the general population. So that's very reassuring. However, we do know that other respiratory viral infections, such as influenza, have been associated with issues such as low birth weight, as well as preterm labor and birth. It's important to note that having a high fever during early pregnancy in the first trimester can increase the risk of certain birth defects. It is critical that you practice good hand hygiene and social distancing in order to limit your exposure to the virus and your risk for infection. So what are the risks to your baby? Right now, and again, data is changing every single day, but there have been no reports of what we call vertical transmission from mom to baby. That means transmission of the infection to the baby while mom is still pregnant. We have not found the virus in amniotic fluid, and so it looks like the baby is probably well protected during pregnancy. We have all seen the few case reports out of the UK and other areas of the world where newborns have tested positive for the coronavirus. And we believe that these are infections and transmissions that occurred shortly after delivery. So that makes the conversation about separating moms and babies even more important. We are fortunate at Women's and Children's that we have in-house pediatric, nursery, and infectious disease specialists, and we have been working very closely together for the past 2 weeks in order to prepare for this. We have been learning new information every day, and we will continue to work closely with those pediatric specialists in order to keep your baby safe.